Dear students, epistaxis, how do you diagnose? How do you know whether it's an anterior epistaxis or a posterior epistaxis? Take a patient's history properly. So when we talk about anterior epistaxis, it is usually unilateral from the anterior aspect of the nose and the bleeding is usually minimal. When you're talking about posterior epistaxis, it usually occurs from both the sides of the nose and more often it is drips in the posterior pharyngeal wall and comes out of the mouth, and it's usually profuse in nature. So what we need to remember as far as epistaxis is concerned is there are multiple causes that can happen. The most common site of bleed is the little's area as far as anterior epistaxis is concerned. In children, it is nose picking, which is the most common cause. When you talk about adults, the most common cause goes posteriorly, that is in the Woodruff's plexus, and hypertension is the most common cause of posterior epistaxis. If you are given images like the ones that are there in the slide, you have a nasal mass which bleeds with spores on the surface. Think in terms of rhinosporidiosis. You have a lady or a man, for that matter, presenting with loose teeth, and you see a mass in the nose. You have a mass in the palate. Think in terms of malignancy producing epistaxis. There can also be a sharp spur present on the lateral nasal wall, that is impinging on the lateral nasal wall, which can produce epistaxis. You have this blackish crust in the ala, in the nasal cavity, presenting with epistaxis. Think in terms of mucormycosis. You have these multiple spots on the tongue and multiple spots in the nasal cavity. Think in terms of hereditary hemorrhagic telangiectasia. And you have a thick calcareous substance which is present in the nose. Think in terms of a rhinolith. There are multiple other causes which can produce epistaxis. There can be systemic causes, granulomatous causes. When you talk about granulomatous, you have rhinoscleroma, rhinosporidiosis. All these are granulomatous conditions. Systemic causes, we are thinking in terms of liver disorders. It can be platelet disorders. It can be leukemias. All these can produce epistaxis.